Hi there, I'm Diana Williams, owner and founder of Strategic Wellness Center. I founded Strategic Wellness Center in order to help men and women with chronic conditions such as autoimmunity, hormone imbalance, chronic digestive issues, high blood pressure, heart disease, and autoimmunity. I myself was dealing with my own autoimmune conditions that left me very debilitated. I was pregnant with my second daughter and was diagnosed with several autoimmune conditions, one that affected my skin and another that affected my thyroid. It wasn't until I found functional medicine and really addressed the root causes of why my conditions were actually happening in the first place was I able to put them into remission. The conventional medicine route is amazing for acute care, right? If you have a heart attack and need to go to the hospital, they do a really good job in helping to save your life. The problem comes in with chronic disease management in the US healthcare system. Unfortunately, it has become a pill for every ill, where we go in, we get a quick 8-minute office appointment with our doctor, we get a diagnosis, and then we get a medication. Those medications oftentimes are just used to treat the symptoms of the disease versus actually treating the disease process at the core level, at the root cause. So Strategic Wellness Center is different. So yes, we do a lot of hormonal balancing for both men and women. We do that through a functional approach. We really believe that hormone replacement therapy is an amazing tool that we can use to help people feel better, slow down the aging process, and improve outcomes for a lot of conditions. However, we really want you to understand that there's some very intricate things about hormones that you need to know before starting hormone replacement therapy. The benefit of Strategic Wellness Center is that we do hormone replacement therapy through a functional medicine lens. So we're not just going to give you a prescription for your hormones or put a pellet in you to put your hormones at a level where they were 20 years ago. What we want to do is look at the body holistically. All the hormones in the body talk to each other, meaning they're very synergistic. So if we address just your estrogen, progesterone, testosterone without addressing the root cause of why they were deficient in the first place, you're not going to ever feel as optimized as you should, but also those hormones can actually go and create metabolites elsewhere in the body and actually have worse outcomes. So through a functional medicine approach, we can actually look at the body holistically, address the root causes, but also keeping your risk factors low while giving you wonderful outcomes. So when we do our hormone packages, what's really important to note is that we're going to look at all the hormones in the body. We're not just going to look at estrogen, progesterone, testosterone. We're going to look at your thyroid function. We're going to look at inflammation in your body. We're going to look at how you can get hormones out, not just putting them in. So looking at detoxification pathways. And we're looking at also things like an adrenal gland function. We're looking at your micronutrients. So one of the root causes of why you're not making hormones in the first place, why you're hormone deficient, is because you don't have the micronutrients that are necessary for the gut and the internal organs in the glands to actually make these hormones. So we're going to look at the whole body holistically. Pellet therapy is an amazing tool that we can use to help optimize hormone therapy. What's important is we don't just take patients for hormone replacement therapy if they're hormone naive and put them on pellets. One thing is that you want to understand is that if the body's toxic or if the body's inflamed, you should never go on hormone replacement therapy until you first address the root causes. So after we looked at those root causes, pellet therapy is great. However, I would never put pellets on someone who is naive to hormones. If their body hasn't seen estrogen, testosterone, or progesterone in quite a while, you don't want to jump straight to pellet therapy. So we can customize and personalize your approach to hormonal replacement therapy through creams, through troches, through whatever the case may be. We have the capacity to actually compound them at specific doses, and we monitor you. We monitor you throughout the process to make sure that that's the right dose and the right route of therapy, and then we could talk about the long-term convenience of pellet therapy. So I hope this video kind of helps you understand the intricacies of hormonal replacement therapy through a functional medicine lens and why we choose to use a very holistic, comprehensive approach to managing your hormones.